Welcome, everyone. So today we're going to dive deep, right inside the human body, to take a look at some of our smallest, but, some of our most dangerous enemies.
Have you ever thought about it? What's really causing all that trouble? That dysentery, the infamous deli belly? Well, we always blame bacteria, don't we? But the answer isn't always bacteria. Very often, the real culprits are these tiny, single-celled organisms we call protozoa. So what are these things? Well, think of them like this. They're tiny, freeloading tenants that move into our body, and they can absolutely wreak havoc on their host, which, of course, is us.
Okay, so listen up. Here's our plan of attack for today. We're going to look at amoebiasis first, then giardiasis and trichomoniasis. After that, the big one, Kala-Azar. Then we'll discuss a really important modern strategy, combination therapy, and we'll wrap up with the key takeaways. We'll tackle these enemies one by one.
Right, so our first case file is amoebiasis. This one is caused by a nasty little thing called Entamoeba histolytica. And the tricky part is we have to fight it in two different places at the same time. It's a two-front war.
Now, this is what's so interesting about it, this dual nature. You see, on one hand, you've got the infection inside the gut. That's the luminal form. But then, some of these invaders escape the gut, and they start forming abscesses elsewhere in the body, most often in the liver. So you're fighting them inside the intestine, and you're fighting them out in the tissues.
So the main funda here, the main principle, is a 1-2 punch. Step 1, you hit the invaders in the tissues hard. We use drugs like metronidazole for that. Step 2, you have to clean up what's left behind in the gut. For that, you follow up with something called a luminal amoebicide to clear out the cysts and make sure the infection doesn't come back.
This table, this is our arsenal. It shows you exactly what to use, you see? For serious stuff like acute dysentery or a liver abscess, you hit them with both types of drugs. But what if someone is just an asymptomatic cyst passer? They don't have symptoms, but they're spreading it. In that case, a luminal amoebicide alone is enough. Remember this table, not just for your exams, but for your patients. It's critical.
All right, let's move on. Our next case files are giardiasis and trichomoniasis. Now, these are caused by related protozoa, and you'll see that they often respond to the very same drugs.
And look at these names. You're going to see them again and again. Metronidazole, tinidazole. These nitroimidazoles are the absolute workhorses for treating both of these conditions. Very, very useful drugs.
Now for giardiasis, which causes that acute watery diarrhea, the treatment is pretty straightforward. A few days of metronidazole, or even just a single dose of tinidazole, often does the trick. But keep in mind, about 10% of patients might not be cured on the first go, so you might need a second course or a different drug.
And for trichomoniasis, this is a very, very important point, Butchel. It's a sexually transmitted disease. So what does that mean? It means treating just one person is a job half done. It's useless. You have to treat both partners at the same time to stop them from just passing the infection back and forth to each other.
Okay, now, for our most formidable foe, visceral leishmaniasis, or as we know it, Kala-Azar, the black fever. And let me be clear, this one is fatal if you don't treat it.
The stakes are just incredibly high. We're talking more than 20,000 deaths every single year. And right here in India, especially in Bihar, we are at the absolute epicenter of this battle. We have a huge burden of this disease.
So, for years and years, we used to rely on this one drug, sodium stibogluconate, or SSG. It was the standard, the old champion. But the parasite is clever, it adapted, and now there's widespread resistance. So in our country, this champion has been retired. It's just not effective anymore.
So what do? We bring in the big guns, amphotericin B. This is our heavy hitter. It's incredibly effective. We're talking up to 99% cure rates. But there's a big but. It's toxic, it has serious side effects, and it's a pain to give. It needs slow IV infusions in a hospital.
Then came miltefosine. And this was a true revolution, a real game changer. Why? Because it was the first effective oral drug for Kala-Azar. Suddenly, treatment became so much simpler. It's now the first-line drug in our national program. But we have to be so careful to use it properly, because if resistance develops to this, we're in big trouble.
So the crucial thing for you to know is the protocol. This table summarizes what our National Vector-Borne Disease Control Program recommends. You can see miltefosine is first line, amphotericin B is second line. Now, the WHO prefers liposomal amphotericin B. It's much less toxic and the course is shorter. But it's very expensive, so that's a big factor for us. Now, fighting these clever parasites, it isn't just about finding more and more powerful drugs. No, it's about having a smarter strategy.
Just like we do for TB and HIV, we team up the drugs. Why? Well, look at all these reasons. It slashes the risk of resistance, you get higher cure rates, you can shorten the treatment time, reduce toxicity, you might even lower the cost. It is simply a better way to win this war and make sure our medicines keep working in the future.
And this isn't just theory, you know? Look at this. These are results from studies done right here in India. Combining these drugs gives us cure rates of 98 to 99%. And look at the treatment time, just 7 to 10 days. This is the power of smart combination therapy in action. It's fantastic.
So I'll leave you with this thought. We have these powerful weapons, these drugs, but the microbes, they are always adapting, always evolving. So is our next big challenge really about finding a new drug? Or is it about perfecting the art of war, perfecting our strategy against these ancient diseases? It's not just about the molecule, it's about how we use it. Think about that.